You actually showed something very interesting about the effects of sulforaphane on a certain type of microbe species, H. pylori.
Yeah. So H. pylori is known in its full name is Helicobacter pylori. Helicobacter pylori is a very interesting organism in that it grows primarily or exclusively in the stomach, and it occupies that niche in a very unique fashion. It apparently has an enzyme that is called urease, but an enzyme that allows it to neutralize the pH in a little microenvironment around the bacterial cells in the stomach. I shouldn't use the term gut because we also use the term gut to refer to the intestines. So the stomach is very acid, extremely acid. That's part of the way it does its job. And Helicobacter tunnels into the mucus layer inside the stomach and creates, with enzymes, creates this little zone of neutral pH, which allows it to thrive. Otherwise, it would be killed, as are any other, or almost any other bacteria that enter the stomach. And it's a very interesting critter, if I can use the term. Can I call it a critter?
Yeah.
It's a very interesting critter because some people, some very well respected and well known microbiologists, for example, Martin Blazer at NYU, maintains, and I happen to drink this Kool-Aid, I happen to believe this, that Helicobacter's been around all during our evolution, the evolution of humankind. Certainly for tens of thousands of years, people have had Helicobacter in their systems. And something like 55% of the world's population at the moment has Helicobacter in their systems. In some areas, recently in Japan and certainly some areas in Africa and Asia, almost all people have Helicobacter, and some areas of South America. And it's a colonizer. It's a commensal symbiotic organism, it would appear. It may actually confer benefit on its host, in other words, you, the person. If levels of Helicobacter get too high, if the number of bacterial cells per square millimeter, per square inch, or per square mile, or however you want to quantify them, gets too great, then they start to have clearly pathological effects. They can cause ulcers, they do cause ulcers, and that can eventually lead to stomach cancer. I believe the last estimate I saw was that the World Health Organization considers Helicobacter to confer a 3 or 4 to 6-fold increased risk of stomach cancer if you're colonized. But the question is, if you are colonized with Helicobacter, can you reduce the levels of colonization, keep it down to a low roar, as it were? In other words, let a few of them hang around in your stomach as long as they don't overrun the system. And so the prescription for someone who has Helicobacter in this country, and I believe in Europe, I'm not a gastroenterologist, but is to wipe it out. So to treat it with so-called triple therapy, 3 separate antibiotics, and kill it so you can't find it anymore. An alternative, and I should say about 15% of people who are given that treatment either can't take it or it doesn't work. So an alternative that many people find appealing is a dietary approach to controlling Helicobacter. In other words, and we don't have answers to these questions, but if so many people around the world are colonized, and it's been with us for so long, and humankind is still humankind, are there perhaps benefits to having it? So, for example, it's been shown, I believe this was Martin Blazer who showed this a number of years ago, that there's an inverse correlation between Helicobacter infection and childhood asthma. So, it may protect, due to stimulation of the immune system, other mechanisms, it may protect against certain diseases, but we just don't know enough. So maybe reducing the levels of Helicobacter in the stomach, again, keeping it to a low roar where it can't cause inflammation, or where it doesn't cause major inflammation, doesn't give you ulcers, maybe enough to reduce the risk of its causing stomach cancer at some point in the future. If it doesn't cause inflammation and there are only a few cells here and there that are sort of hanging on, maybe that's okay. So that can be done by a dietary approach. And with that in mind, we actually looked at the ability of sulforaphane to kill Helicobacter. Of course, if it had wiped out all the Helicobacter in people who were infected, I would have been happy with that also. That would have certainly been an interesting finding. What we ultimately found, and this was done with collaborators in Japan in a 50-person trial, we found that Helicobacter can reduce the levels, that sulforaphane, or broccoli sprouts actually, fresh broccoli sprouts, were able to reduce levels of colonization in infected people or colonized people, and were able to reduce markers of inflammation in those same people. That work grew from an observation that I made with a different colleague, a French colleague, who was visiting the US on sabbatical, Alain Lozniewski. So he and I discovered and published in about 2002 that in vitro, in a test tube, sulforaphane was very capable of killing Helicobacter. Not only did it kill natural strains, but it killed strains that he had recultured from some of his patients. He's a gastroenterologist. And it killed singly and doubly antibiotic-resistant strains. So as you know, antibiotic resistance in bacteria of all sorts, in all settings, is a huge problem, and Helicobacter is no different. Once Helicobacter in people starts seeing a bunch of antibiotics, some of them develop resistance, including resistance to two of the commonly used antibiotics that are used to treat it. So the fact that sulforaphane was equally effective in killing them was, we thought, quite significant. And interestingly, sulforaphane is not as potently antibiotic against a whole variety of other bacteria.
So do you know why the H. pylori is so sensitive to it?
You know, we don't. We thought we had some clues. We thought we had some clues, and actually, Dr. Lozniewski's colleague in France had done some work on that, which was never published. This colleague, for reasons that we need not get into here, is no longer in the business of science, and so that paper never got published, and we never really finished the proof. So we're not sure why it's so potently antibiotic. One thing that I can tell you is that in the quest for that answer, quite recently, Kitty Stevenson, who works here with us, and I started looking at the ability of sulforaphane to inhibit urease, which is that enzyme that I told you that creates, that neutralizes the pH in the mucus of the stomach. And we found that indeed sulforaphane is quite an effective inhibitor of that enzyme. But, so again, we thought we had a real eureka moment, but it turned out that wiping out that enzyme wasn't sufficient to kill Helicobacter because strains, how do I put this? Strains of Helicobacter that had been engineered by others to not contain urease were still killed by sulforaphane. So it wasn't, so the urease, so inhibiting urease might be important from a disease prevention standpoint, but it's not how the molecule killed the bacteria. Okay. Sorry to present such a complicated story, but that's the way things roll
science.
In this business.
Yeah, for sure. Yeah. But the also very not surprising to me results of it lowering inflammation is one of my obsessions with sulforaphane, generally speaking. I'm very interested in anything in my diet and my lifestyle that I can do that will lower the amount of systemic inflammation that I have in my body. And sulfur, it's been shown in, you've shown this, and others have shown that, you know, even broccoli sprout extract powder given to people can lower C-reactive protein levels by as much as 20%. Other inflammatory cytokines, IL-6, can be lowered by something similar. You know, so it's having a robust and measurable effect in people. You know, that's been repeatable in several different studies that I've seen. But one of the reasons I'm so interested in this is because, well, inflammation really, you know, plays a role in a lot of diseases like cancer, but it really seems to be a driver of the aging process. And I don't know if you've, I think I mentioned this to you briefly.